You're watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, what you need to know if you're considering dental implants. If you're missing one tooth or all of your teeth, and especially if you are wearing a loose-fitting denture, my advice, stick around for the latest edition of The Wellness Hour.
The Wellness Hour, an in-depth discussion with today's top physicians and medical leaders. And now, your host, Randy Alvarez.
You're watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, what you need to know if you're considering dental implants. With us we have well-known periodontist, board-certified, Dr. Stephen Brown. Dr. Brown, welcome to the program.
Thanks for having me, Randy.
Now, before we get into today's topic, I guess this is a big topic.
It certainly is.
Dental implants have become mainstream, as you say.
They have not only become mainstream, they've become predictable, they've become long-lasting, and they've become life-changing.
Now, when you say predictable, they don't fall out. Is that what we're talking about?
Indeed. We have over 40 years of experience now with dental implants. What I tell my patients is, if an implant survives a year, and better than 95% of them do, it'll last the rest of your life.
So what is a periodontist? We'll start there.
Well, a periodontist is somebody who deals in treating periodontal disease, which in fact is the largest cause of tooth loss in the world. And in fact, more recently, we've learned that the periodontal disease often has relationships to other systemic diseases, such as heart disease, stroke, premature babies, and a whole host of other things that we've learned. So periodontists are uniquely trained to do that, but more importantly, they are uniquely trained to do dental implants because they understand all of the tissues that are involved, meaning we understand how bone reacts to an implant, we understand how soft tissue reacts, and what's important to the patient is the ability for us to create something that is invisible.
So a lot could go wrong. We talked off camera in the hands of somebody inexperienced, because I guess any general dentist can do this. Is that right? This procedure? Any
general dentist can do it, and any oral surgeon can do it. We feel that the periodontist is uniquely qualified.
Biased, okay.
I'm biased, yes, uniquely qualified to do it. But in direct answer to your question, people who are unskilled can place implants. You know, what's important is the diagnosis, the treatment planning, knowing where and when and how to produce a successful result.
What are the different categories of dental implant patients you see?
Well, there's an entire spectrum of implant patients. The most common or the simplest would be a single tooth implant. This would be where somebody is missing one tooth and doesn't want to have their teeth cut down for bridges, and they choose a dental implant. If there were 3 implants or two teeth missing in a row, we can place 2 implants. Oftentimes, if we have to replace 3 teeth, we can do it with 1 implant on either side of a space and connect them. But one of the most rewarding types of implants are the kind that we give to patients who've been wearing dentures. Oftentimes, these patients have become what I call dental cripples. They are people who are unable to chew properly, they're unable to speak properly, they tend to cover their mouths very frequently, they don't like to smile, they don't like to laugh.
You say they don't know what they're missing.
They really,
elaborate on that.
They really don't know what they're missing. When someone's worn a denture for a long time, they adapt to it. We all adapt to certain things. Our personalities are such that we learn to live with what we have. And after a while, one forgets what they've lost. They've lost the ability to feel food in their mouth because there's plastic against their palate. They've lost the ability to not have to chop up food into pieces so that they can eat it more readily.
So you say with only 2 implants that oftentimes people count their teeth and they rule themselves out. With 2 implants, you could secure a lower denture. Is that correct?
One of the biggest questions I get asked is, how many implants do I need? Well, I can absolutely alter a patient's life for good with as simple as 2 implants. Dentures have inherent ability to cause tissue to break down, meaning if somebody has worn a denture for a long period of time, they will lose a lot of their jawbone, the height and the width of their jawbone.
Why? Because no pressure on the bone, or what is it?
This is because there is pressure on the bone. Once a tooth is extracted, there's an 8-time more probability that there will be loss of bone structure than when teeth are in place supporting the bone. So if somebody's been wearing a denture for a long time, they've lost the bone height both vertically and horizontally, which is what gives them that sort of kind of
sunk-in look.
Yes, it does.
Interesting.
And we could do more oftentimes than a plastic surgeon in giving somebody back their appearance just by giving them back their teeth, which restores the shape of their face, the height of their face, and gets rid of the wrinkles.
Now, going into this interview, my mother's 73 years old. She's been in dentures, she says, since she was 28 years old. She also informed me she's too old for dental implants, she says. Says her medical doctor told her that.
Let me tell you a story, Randy. I had a woman, we called her Mom. She was 87 years old. Mom was full of life, vibrant. She played cards every day. She went to the movies, etc. She did not want to have implants because she thought she couldn't have implants.
Okay.
We placed a number of implants in her mouth, and I can remember to this day as she hugged me at the end of the appointment, she said, "There's no stopping me now." And she marched off.
Why would an 87-year-old want to do this, though?
Well,
at that age.
She wants to be able to eat. She wants to be out in company socially. She wants to feel confident when she speaks and when she smiles and when she laughs.
Interesting.
Another story. I had an 86-year-old gentleman who on a Friday we placed 13 implants. And on Saturday, I had reason to go to my office with my son. We're driving in the car, cross street by my office, and who do I see walking across the street, arm in arm, dressed as natty as could be, this gentleman and his wife. You would think that nothing had happened the day before.
Yeah, so 87 years old.
87 years
implants. And now how soon could he eat, by the way?
He could eat within days. I mean, in the beginning, certainly he's going to go with softer foods for a couple of days, but within a week's time, he was able to eat most everything, and within a month or two, there was no stopping him either.
So you say pain is not something they complain about?
In fact, it isn't. This is another myth that needs to be dispelled. If I were to pinch your skin, that would hurt.
Okay.
It hurts because there are nerve endings in your skin. But the jawbone is unique in that there are no nerves running through jawbone. So that if I make a small site in your jawbone by making a little penetration, there's absolutely no discomfort.
Interesting.
The patient only feels ever possibly the incision that's made in the gum. And that's a minor amount of discomfort. And today, we're even able to do implants without making any incisions at all.
You mentioned that's a misconception.
Yeah.
What other misconceptions are there about dental implants?
There are many misconceptions about dental implants. One of them is that an implant's a tooth. In fact, it isn't. When we lose a tooth, we've lost 20% of the tooth is what we see in the mouth.
Okay.
80% is what's in the jawbone, the root. What an implant is a man-made tooth root. Second common question that I ask, and misconception, is, am I going to reject this? And I have to explain to patients that there's a difference between a transplant, as in a kidney or a heart, and in an implant, which is, as I said, a man-made tooth root. I make the analogy to the pin that an orthopedic surgeon would put in bone to reinforce it. And in fact, an implant reinforces bone.
Now, another thing, that things have changed. In the old days, it could have taken a year for the process.
Indeed. How
has that changed?
I'm sorry. In the old days, the way in which it was done was we first would place the implant. If it was a lower, it had to be at least 3 months. And we couldn't put them when we took the teeth out. We couldn't place them when we took the teeth out. So consequently, the teeth were extracted, we waited several months, and then we placed the implants, and if it was a lower, we had to wait at least 3 months, according to the protocols that we used then. And if it was the upper, it was 6 months. So it easily could take a year to 18 months to do a complete case.
And now?
Today, we can place an implant in the same day, place a tooth on it, and the patient walks out of there with a new tooth. Let me give you an example of that.
Okay, okay. You brought a lot of photos. Let's take a look at some of these photos.
Yes. This was a young lady. She was about 25 years old. She was applying for jobs, and people would see this, and it made her not only upset, but in any social situation, she felt
So
absolutely...
the side tooth was missing.
Yes, it
Okay.
was. In one visit, we were able to give her back her tooth, her confidence, her smiling, her ability to interact, and no fear socially.
Okay, help me understand then. Let's start with a single tooth, and I have a lot of questions about what you could do for the denture wear. Why a single tooth? Why a dental implant? What's your argument there?
Oh, I think that there's no argument, quite frankly.
Okay.
The alternative for somebody who is replacing one tooth are to have something that's akin to a retainer with a tooth on it. It's something removable. It has plastic. It goes across your palate. It collects plaque. It collects debris. It can cause tooth decay, and it can cause irritation to your gums. So as an option with the one tooth, we have the possibility of this removable appliance. Similar to this.
Okay.
It is a totally unacceptable thing for most people for any number of reasons. The more common way to replace this tooth would be to whittle down two adjacent teeth, much as it is in this picture here. But here's the main reason why you don't want to do this. If we have to replace this every 5 or 6 or 7 years, each time we lose more tooth structure. Each time we have more opportunity for a need for root canal. Each time we have more opportunity to actually lose the tooth due to gum disease or other problems that occur. Fractures are very common. When that happens, you have to extend the bridge. So this starts to be a domino effect. First it's 2 teeth, then it's 3 teeth.
Is this an exaggeration? I mean, this is what happens? It starts with the one tooth.
There is abundant research that has shown what happens when a single tooth is replaced with conventional dentistry. On the other hand, the miracle is that an implant that's placed well in good bone is likely to last the rest of the patient's life, and it has not in any way, shape, or form taken anything away from the adjacent teeth, the underlying bone, or the gum.
Okay, so now we're just about out of time. We have to take a quick break. You have more photos. What are we looking at?
I do. All I want to show you is what can happen by giving somebody back one tooth. This young lady had a missing tooth that she was born without. She had braces on her teeth for a short time in order to get them into place. We placed the implant.
Looks real.
Look at the change in her smile. Look at the change in her persona.
She looked like a little kid before. Now she looks like a woman. Very pretty.
The story gets better. She went off to the Peace Corps. This was several years ago. When she finished in the Peace Corps, she joined with the U.S. government, and she is now in Iraq. And she is helping to change the lives of the Iraqi people as they rebuild that country.
Okay.
Here's another one. In fact, this is one of my favorite ones. This woman had been wearing dentures for 25 years. She had had all of the possible relines and attempts to make it fit better. She had probably been to 15 different dentists. All of them told her they couldn't make her dentures. Most of them told her that there wasn't enough bone. She was in tears.
Did they offer her dental implants?
They did not offer her dental implants. They told her she wasn't a candidate for dental implants. So we went through our ordinary diagnostic routine. We got the scans that were necessary, and I promised her that I would find enough bone, because it is the rare patient in my experience who we can't. She herself didn't believe. And in one visit, we were able to place 2 implants. That's all she required.
The lower jaw I'm looking at?
This is the lower jaw. We could place a denture on top of that implant with simple connectors like this, and in no time she was able to smile again. She had not been to work for about 1.5 years because she did not feel comfortable in going in without teeth, and she couldn't hold her teeth in.
It's just a snap in.
Just
snap
literally
out.
snaps in. Let me show you.
Okay.
Here's an example of a model, and you can see that there are 2 simple little snaps that barely come through the gum.
So 2 implants.
2 implants. We put this denture on, which would be like this normally, snap it in, and it's
Make it in
firm.
again. It's that easy. And again, pain there?
The amount of discomfort that this patient had, if you were going to, she said, I have more discomfort from wearing my dentures than any discomfort you ever gave me from placing implants.
Are there denture wearers that are fine, that are okay? I mean, did they tell you, yeah, my denture's okay?
Very many people say, my denture's okay.
I mean, you think they're in denial in a way?
I don't even know that it's denial. They've learned to live with the problem. They don't anymore know what they're missing.
Then do you think they count their teeth and think, wow, that's too much money, I'm not going to get dental implants?
You know, that's another myth, Randy. The whole idea that implants are expensive. The truth of the matter is that what's expensive is conventional dentistry. Conventional dentistry that doesn't work. I don't mean to denigrate dental care, but dentistry that doesn't work. The dentistry we were talking about before, where we go from one thing to another thing, it gets worse. When a patient has lost their teeth, they've spent a lot of time in the dental office, they've spent a lot of money, and they've had a lot of tragedy around that. So consequently, if we can give them back something that is predictable, that lasts a long time, that gives them their self-esteem back.
I mean, 60 is young today.
60 is very young.
A lot of people out there in their 60s wearing dentures. And I guess, most people don't like the dentist, right? Is that why they don't go to do something about it? If it's as good as you say it is, 2 implants securing a lower denture, why doesn't everybody do it?
Well, I think the most likely reason why most people don't do it is because they don't know enough about it. And we've done a poor job.
Are they afraid of it?
Well, there's fear. There's also the fact that they're frustrated with what they haven't gotten over the years, with the process that has brought them from where they were to where they are. And for that reason, they're not happy about going through something else and spending money to do it.
Does a denture wearer go to the dentist? I guess for the most part they don't.
They don't.
So nobody's telling them to do it.
What's interesting is that regular dental patients, let's say they come back to their dentist twice a year. Denture patients may not come back for 6 to 7 years. And they don't even come back because they need something done. They only come back when they have a problem.
And we have to take a break. More about what you can do for the denture wearer. But final message before the break. Anybody missing teeth, and especially those denture wearers, what do you say to them?
Check it out. Find out if you're a candidate. You only have to lose your adhesives.
Only have to lose their adhesives.
The only thing you have to lose is your adhesives.
Okay, good. You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Up next, more photos and some information you need to know if you are a denture wearer. We'll be right back. You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, what you need to know if you're considering dental implants. With us we have Dr. Stephen Brown. Okay, Dr. Brown, you have more photos here. You like dental implants,
I love dental implants because what we're able to do for people is so exciting. In all other dentistry, you asked earlier why people don't like to go to dentistry. In all other dentistry, we're doing things that are takeaway. We cut down teeth for crowns. We remove tooth decay.
Like a patch-up or something.
Yes, we do gum surgery. Here we're giving people back what they've lost. They can smile again, they can laugh again, they can embrace life again.
You say they become more active with.
Well,
what sounds
my
like
experience. My experience has been that people wearing dentures and people missing teeth tend to withdraw. They tend not to want to be out in public. They tend not to want. They have to think about what they eat. They have to think about how they can clean their dentures. They have to think about the bad breath.
Okay.
All of those things. But there are other exciting things that happen. And this is a very good example of how you can change a life.
All right.
This woman was missing 2 teeth in the front of her mouth for her whole life. She was born without her lateral incisors.
Just born without 2 teeth on each
side.
Right
in the upper front of her mouth.
Okay.
And what you can see here is a certain type of smile. This was a vibrant, vibrant woman. This is what it looked like with the 2 spaces in front of her mouth.
Did she tell you, by the way, she's embarrassed to smile?
Not only did she tell me she was embarrassed to smile, she'd been wearing a partial for years, which had affected her other teeth as well as the gums on the palate of her mouth. So we were able to put 2 implants in, and look at what we get as a result. But here's the most rewarding part. This is that same woman.
$1 million smile.
The $1 million smile. Couldn't be happier, is telling everybody about implants. She was terrified. She was absolutely terrified. She had no discomfort.
Why did she wait so long, by the way?
She didn't know it existed. She finally got herself into the hands of an excellent family dentist who I work with closely, and he referred her and said, you can have these. All we need to know is, do you have enough bone? Do you have enough quality, quantity,
And how long does that
volume
take,
of
by the
bone?
way? Somebody goes into your office. How soon could they find out, that they're candidates?
In one visit, we're able to examine them. We're able to determine what their physical health is and whether or not they're a candidate in that regard. We can take a look at them clinically, and then generally we take regular films in the office, and then we send the patient out for a CAT scan. Now here's another one. She never liked her smile. When she smiled, this is what she looked like, and this is what she hated. She was told also that she had to lose a lot of teeth. And the one thing that caught her attention
Because
was,
they were pretty white, these
Yes,
teeth.
but-
They look from just the teeth pretty healthy, but they had to
they're-
go?
Yes, she had periodontal disease.
Okay.
She had lost a lot of bone. Her teeth were crooked. They were moving around and shifting in her mouth. And she was really unhappy with the whole situation. But what was the selling point for her, in addition to just getting a new smile, was the fact that she'd never have to be without her teeth, that she would have fixed teeth in place through the whole process. And so what we did was we salvaged a few teeth to support a provisional or temporary bridge, and then we worked the implants in between the teeth, so that in a very, very short time we changed that to this.
Very nice.
And is this a different person?
Yeah, it really does look like a different person. So in the front area, you can make them, what are they made of? Porcelain, as far as the tooth structure?
These are crowns that are porcelain fused to gold. This woman's entire mouth has been restored with implants. You cannot, the greatest thing in dentistry is if you can create the dentistry being invisible, so that somebody looking at her says, gee, she just had her teeth capped. No. They look at her and say, what have you done?
It's a world-class smile.
Your
Also,
smile is
I
great.
think when you put these side by side, there's a class difference. All you do is you fix her teeth, and you can see. I think anybody, when you put these side by side, could see the difference.
It's what's exciting. It's what brings me to work every day. It's the kind of thing that I never knew that I would be able to do when I graduated
So
dental school.
her options were what? A denture? Is that what somebody was?
That's what they were offering her. They take your teeth out and we'll give you a nice set of dentures.
How'd she hear about you, this attorney?
Well, I had treated a very good friend of hers from New York as well. And we're very fortunate in being in an urban environment. We have a tremendous diversity of patients, and they come from all over. So I've been very lucky to have a reputation in which people know that if they come to Philadelphia, they're going to get it done right. They're going to get it done once, and they're not going to have to do it over again.
Do you do the consults?
I do the consults myself. I want to know the patient before I know their teeth.
What do the denture wear, by the way? Something fixed in their mouth. We've talked a lot about 2 implants, snap in, snap out. So is that the #1 requested item? Give me something that doesn't come in and out. It's just fixed in your mouth?
Randy, patients would like to have what is the most natural possible thing. When they come to us, we offer them options. The truth of the matter is that depending upon the amount of bone that they have, may determine whether or not they can have fixed. But almost always, if somebody wants a fixed denture, or if they want fixed teeth, we can give it to them. It's only a matter of how many implants. As you saw before, 2 implants are enough to secure a denture, but think about an upper denture for a moment. We meet the public with our smile. We meet the public with our teeth. If we have a sunken-in look because we've lost bone, then we don't make the same impression on people when we first meet them. So if we can simply place 6 to 8 implants, 6 to 8 implants alone will give us everything that we need in order to stabilize permanently. This is a doctor removable only.
You say that they could taste their food better. How so?
Well, the biggest problem with wearing dentures, particularly on the upper denture, is that there's plastic or metal across the palate. Can you imagine the difference between drinking a cup of coffee and feeling that cup of coffee against your palate, or the textures of foods against your palate? If we can have a denture that's permanently fixed in place, that has no palate, meaning there's nothing up here, nothing that the patient is going to feel like there's something foreign, false. They don't get food caught under it.
Is that the biggest, when you do the upper, are they very pleased? Do they tell you, I can't believe I what I was missing. What do they say?
They say, I can't believe what I was missing. I can chew foods that I couldn't chew before.
Could they eat a steak? Or
I've
corn on the cob?
lost wrinkles.
Okay.
That's one of my most favorite. And yes, they can chew a steak, bite into an apple, eat an ear of corn. They tell me that they didn't understand the way it could be. I have not yet had one patient ever who has said to me after having implants that they wish they hadn't.
Final message, we're out of time. And great information here. Somebody missing teeth, what do they need?
There's no reason to go with a missing tooth in this day and age. As I tell my residents, anybody who's missing a tooth is a candidate for dental implants. It can literally change the way you live, change the way you eat, change the way you present yourself to the public.
And you could be 98 years old.
And you could be 98 years old. I'm looking for my first 100-year-old patient.
All right. Thanks again. Very interesting stuff.
Thank you for having me.
Thanks for coming on the show. You've been watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. If you would like to see this program again online, visit our website at wellnesshour.com. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.